everyone. We are back. We are live. And now we're here with our speaker, Dr. Kavita. And she is an oncologist from Delhi in India. And we actually found her through her Instagram account, which you should all check out at drk.md. And she shares incredible advice and information about medicine, cancer, and mental health in general. And we're so excited to have her here today to talk about what she told us, lung cancer and the patient profile. So thank you so much for joining us here today, and feel free to begin whenever you're ready.
Thank you so much for inviting me. So, this is my first time that I am officially speaking through Instagram that I found you guys. So even this is an opportunity for me. So I consider myself lucky for that matter. So I'm a radiation oncologist. So I am practicing as a senior resident in Delhi, India. So I have completed my residency. So I'm a senior resident at present. So basically, I want to talk about lung cancer because recently I have seen a surge after the COVID cases have dropped down. So we are seeing again the surge of cancer cases. So like as an oncologist, we were already really concerned for our patients who could not get treatment during the COVID times because it had been on a, we were certainly on a back foot during the COVID time because the cases were so much, but this has led to delay in the diagnosis. So what I wanted as an oncologist part that how can we, not delay the diagnosis and identify the early signs, especially when it comes to lung cancer. So lung cancer is most commonly, I think we all know that it is most commonly seen in those people who have, either higher family risk or they have a history of smoking or alcohol. So I just wanted to stress on that point, particularly when we talk about the risk of smoking. So smoking can increase a risk of lung cancer as much as 20 times than a person who does not smoke. So we should be aware of the risk factor apart from the other carcinogens like alcohol. So they also increase the risk of the cancer. But once we stop smoking, we should also know that it also reduces the risk of the lung cancer. So if a person thinks I'm smoking today, so there is, it is a dead end. So even if I stop, there is no going back. But that is not the case as the smoking is stopped. So, after 5 to 10 years, the risk of a smoker who stopped smoking like 10 years back becomes approximately equal to a person who never smoked. It is never equal, but definitely it reduces to a large chunk. So I think that is what about the risk factor of lung cancer. So it is mainly mostly we most commonly see is non-small cell cancer or a small cell lung cancer and adenocarcinoma. That is a little technical, but what we need to know about is in case of small cell carcinoma, it is very much aggressive and it can go either into the brain and to the distant organs like liver and bones. So whenever we talk about cancer, so I think it is a common notion that early diagnosis is our life saving that opportunity we have. That does not mean that we cannot treat cancer in the late stages of stage 3 or stage 4, but in the early stages we should be really hopeful that we can tackle the cancer as much as cure it 100%. So even cases who are really bad in the beginning, I have seen those patients responding very well. So even apart from the chemotherapy or radiotherapy, definitely the personal mindset and the environment of the person in the family members or how much they interact with other people around definitely makes a huge impact on how much they respond to the treatment. Because I think there have been so many studies done how mindset of a person can change their outcome of the treatment. So this time I would like to take this opportunity to tell everyone who have been suffering from cancer or who have a family member, creating as much as positive environment and being hopeful. Definitely as an oncologist, if I have a fact in front of me, if I have to break the bad news, like the tumor has spread to this and this organ, so that is a fact which I have to state, just state, because I cannot sugarcoat it. as an treating physician, but you as the patient, or you as the relative or the family member, should still be hopeful. The one and only thing which, I have seen so many patients, like the young children of 6 to 7 years, like they are so hopeful, they still go to the school, they still get all the education, and even during the chemotherapy cycles they come to the hospital taking their books and everything. And it is so, like overwhelming to see the spirit, because even we as an oncologist, we sometimes give up hope that okay, like how can we treat this girl or this girl child. It is very overwhelming at certain times. But like to learn from them and seeing, whenever you see a cancer patient, he or she is like, what I'm telling from my experience, like they just live in the moment. They like, you will never see a sigh or worry on their face whenever they come to the OPD. Like I have so many like younger children who have like I have treated with the help of my seniors. So they are always so like so happy to talk to, and they don't think about the future. So I think that is one thing which we should focus on, apart from taking the treatment, apart from being hopeful, and apart from being aware of the risk factors that cause cancer, is that yes, it can be treated. And definitely, even being an oncologist, I would say, like we see so many miracles that we cannot explain with the help of medical science. So definitely miracles do happen. So believing that you are one of those miracles is, I think, gonna help us so much. So like if you are in the family of like person who is suffering from cancer, or you have a family history of cancer, so I think the number one step is not being anxious and not talk about cancer all the time. I know like if I have some problem, so I would want to talk about it all the time, or the people around me will be talking about it so much that even if I wanted to forget it, people don't let me forget that problem. So it is similarly with cancer. What I'd advise to my patient is, whenever like you are going, even after chemotherapy or even after radiation therapy, as much as you can slip back into that routine, it will be definitely impossible. And me being a doctor cannot understand the gravity of the emotions and the physical pain that that person is going through. But still we can help them, by communicating to them, that as much as we try to slip into the routine that we have, it will be more easy for us to take it just as a part of the treatment. Definitely chemotherapy and radiation therapy have huge side effects. Like I've seen women crying because they lose hair when the chemotherapy begins. It is very overwhelming to see that. But just like I've seen, like accepting what there is, and now from here what we can do now, so communicating to your doctor that you feel that. Because like most of the time patients feel that we don't want to burden our doctor, we don't want to burden any other medical staff. But I think communicating your worries and your problems and your anxiety, it is okay. So I think that is an important point, because when we suffer from a disease, it is not just only about the physical health but also about the mental health. So I think we should focus on that part as well. So this is like I have felt that people don't take into account, especially the family members. It is not just about the patient but about also the family members of a cancer patient. I would like salute to them, because that patient is suffering, but they have to suffer with that person. So we always say that when a cancer happens, it does not happen to a person, but it happens to the family, because everyone is so in close knit, everyone is involved, so all of their life is affected. So we should vocate that thing, and we should try to be seek help as much as possible. So that is what makes it more possible for the physician to help them, whether it is about the physical problems but as well as about the mental problems, not only of the patient but of the family members as well. So this is mostly like I just wanted to say to the patients and the family members, like they are, like you are doing an amazing job, because each day is definitely a war. You don't know what will happen tomorrow, whether it will be cured or not. But I think relying in the like having the confidence in your treatment is the first step to be positive, and just being hopeful that this can be treated. So you should not always listen to all the negativity and negative connotations related to the cancer, but also look at the miracles that do happen even in the whole medical science. So that were like that has helped a lot of patients. Like I have seen a patient who had rectal cancer. So he was around 80 years old, but like he had so much of enthusiasm and spirit in him, that I've seen taking him all the treatment without any worries, and talking to even us and even the fellow patients, and that creates a positive environment around. So that is like creating positivity around and communicating with each other. I think that is what helps, because sometimes we think only we are suffering, but when we go to an hospital, or when we especially go to an oncology department, we see even like a child of as low as 3 years of age, and a person as old as like 80 years of age. So I think that's what connect them, is that it does not see age. In today's time, I have seen even in case of breast cancer, or even in case of lung cancer, as low as like 25 or 30 years of age. So to be more aware about the risk factors and the symptoms of cancer, I think it is most important. So we can discuss few risk factors associated with general term the cancer, because most of us are not like we don't give value to small signs and symptoms, which I think we should. Like even if you are losing weight, which is unintentional, so we should definitely seek help, because I think it does not come in the common causes, but definitely a very common symptom of cancer is loss of appetite and loss of weight. So especially if you're seeing from like the last 3 months or 6 months, that even people don't notice that they have lost weight, but they have seen that their clothes are becoming loose, and they did not intend to lose weight. So this is one sign of cancer which we should take into account, apart from loss of appetite. And there are certain changes in the skin, if there is any hyperpigmentation or any bulge in the body which you think is abnormal. So for that we should know our body. Like everybody advocates, I'm so happy that everybody advocates in today's time about the breast cancer, the self breast examination, which everybody talks about. Like you can do it either while bathing, or either you're in room, you can in front of the mirror, you can like check your breast if there is any lump, apart from also in the axilla. So that is what kind of awareness do we need in these days, because there are only certain like absolute number of like cancers who come in the most common cancers are being talked about, but nobody talks that much about the rare cancers. So we should also talk about those symptoms. What if you have a swelling in your neck? So whenever a cancer develops, so it has a tendency to go to the lymph node. So we have certain lymph nodes, especially in the neck we have cervical lymph nodes. So whenever you notice a lymph node, or should I say a swelling in your neck, you should never avoid it, always get it checked. It is also it can be present in many infective conditions as well. But if it is hard, if it is more than 2 centimeter in size, that is an indication that you should get a physician checkup, especially in these times when we have to be so much aware. Because as we talk about that, initially when the COVID came, nobody knew about it. Even the doctors did not know about it much, because it was a new virus. But slowly as the time has passed, we have started doing research. Now everywhere we have told everyone that you have to wear mask, you have to get vaccinated, and you have to maintain social distancing. So this is a result of the awareness that governments, all governments have worked together to create that awareness. form of awareness. But this virus, I think, like, this has been in our lives since so long. So this is the time that we start talking about it, and what are the basic things that we should know. That, sitting, like, most people have misconception that if I sit with a patient who is a cancer patient, I may get cancer. Like, I have had relatives who were worried about themselves that they might get cancer because they are coming to the, cancer ward. So these things we need to talk about, that it is not communicable. So these are very basic things that you should you can eat anything you want. You just have to maintain a little bit of, healthy diet, especially during the chemotherapy sessions, because when the term cancer comes, everybody says that you don't have to eat this, you have to stop eating this, you have to stop eating this. So it is never absolute. Like, I have patients come, like, they feel like, today I want to have like fried chicken, can I eat it? So I mean, we have just, little pleasures in life, so we should never like ask them to just have so much control and change their life overall. So having one bite or having one meal like that, so won't make any much difference, and you should be as happy as you can be. So these little things don't affect your prognosis of cancer. That is what I wanted to say. Even in diet, especially after chemotherapy, why we say is because after chemotherapy, the 50 after chemotherapy are very crucial, because the fighting cells in our body decrease. So because the chemotherapy acts on the cancer as well as on the normal cells, so that is a side effect of chemotherapy. That is why in that state, in those 15 days, patient is more susceptible to develop infection. So that's why we advise patients to not eat anything from outside, or anything that is junk food and that is not healthy for them. So I think that is important to know, that you don't have to stop doing anything. If you like eating, so you can continue to that, but also to a certain extent. So that is, I think, about the diet part. And overall about the lifestyle, if we talk about the certain preventive measures, and people talk about the lifestyle, so I think so I was reading this article that even if we do exercise of 30 minutes, as low as 30 minutes is also preventive when it comes to cancer. So even if you are, as a person, if like we have been so busy, and as the COVID has come, we all have to do our works on our phones or laptops, and we don't get time to get up, or we even don't want to, because now we have set into this routine of staying at the home. So I think if you change your lifestyle to a certain bit, that you inculcate those habits, that you just take out 30 minutes for yourself. So like, even the medical research has proven that even 30 minutes of exercise is preventive. So these are certain things which basics about cancer, I think everyone should know. And whenever you like talk to a person who is suffering from cancer, so sometimes we get a little insensitive, because according to us, we are intrigued, we just want to know, or we are caring from our side. But that person, suppose if I am talking to 5 person, and all those 5 people are talking about this only, so definitely I won't be liking that. So that is one thing key we should realize, to empathize what that person is feeling. So not talking about it all the time, I think should be the most important. Like, if you can't do anything, if you can't say anything, that is okay, just be with them. Sometimes you don't need to say anything, just being with them is, provides them the most utmost support. And being hopeful, and not also forcing positivity is one thing, like okay, you should be hopeful, you have this is a less severe form of cancer. So these things I think we should not use specifically when we are talking to a cancer patient. So and specifically if we talk about the lung cancer, so when we talk about lung cancer, so they have many molecular subtypes. But basically what we give is, if it is resectable, and if the person is operable, so we'll go ahead with the surgery, and post surgery we'll go for the chemotherapy as well as the radiation therapy. So when we give radiation therapy to a patient, so any site that involves radiation will be receiving some rays that interact with the tumor cells and kill them if they are in the proliferative stage. Like suppose if tumor and out it goes, I will remove whatever I can see, but there will be always a mic that will always big tumor. We give chemotherapy for the systemic treatment and radiotherapy or radiation therapy for the localized treatment. So whenever a patient is receiving radiation therapy, so few important points they should know, that whenever you receive, I think like every physicians conveys them that whenever you receive a radiation therapy to a particular site, you should not apply too much of cream or too much of lotion in that area, because that area is already inflamed, that is receiving radiation. So there are few cycles, like mostly the radiation therapy is given like Monday to Friday, and Saturday and Sunday are off, and then for the next week. So this way we go for like 4 to 5 weeks depending on the site of the cancer. So each day you have to come, and the treatment lasts for like around 2 to 5 minutes depending on the dose of the radiation that a person is receiving. So whenever you come for radiation, you should always like that area should be clean. Like if there are hair in that area, so they should be removed before the radiation treatment starts. Be removed while the radiation treatment is going. When you have certain lotion or certain emollients you apply on the area, so that is already inflamed. So when you receive radiation, it forms a layer over the skin. So that way the dose of the rays that are coming increases on the top surface of the skin. So that can also lead to major side effects. So that we should avoid. We should avoid any harsh clothes that rub on the skin and provide much friction. Again, that area is sensitive, so if the clothes will rub, they will again cause inflammation of that area, and they can burn off, or they can peel the skin, because skin is very sensitive in that time. So especially in lung cancer, if we talk about lung cancer, so whole of the thorax is getting radiated. So you have to understand, when a radiation goes inside, so they'll be having organs nearby. There is heart, there is trachea, there is esophagus. So these like sadly we don't have very accurate radiation, but we give as much as accurate radiation we want to give, so that the normal structures are not radiated. But there always be some part of radiation that is going to the normal structures like trachea. So you can have some patients complain that they are feeling itchy or dry in the throat. That is because the radiation is causing allergic reaction to that area in the trachea. There if you're receiving the lung radiation, you might also feel that you have problem in swallowing. So that is also because the esophagus is getting radiated, so it might show up as a symptom of radiation. So when a patient has symptoms like during the radiation therapy, like during within a week of the radiation or during the radiation therapy, so that we call as an acute radiation toxicity. And if a person has a suppose symptoms after 6 months, even after 12 months, so there can be late radiation toxicity as late as 12 months. So that is called late radiation toxicity. So we should know about it, that when we should seek help, because when the symptoms are acute, then we are already receiving the treatment and we would vocalize that this problem I am having. But even as far as 1 year it can take for the late radiation reactions to develop. So we should also communicate with our radiation oncologist to convey that this problem we are having, so can it be due to the radiation, or is it a side effect of the cancer? Because whenever we give radiation, the sad part is certain radiation toxicity is very similar to the symptoms of the cancer. So some might feel that the cancer is coming back, but in actually it is only just the side effects or the allergic reaction that develops due to the radiotherapy. So that is what causes the symptoms. So these difference before getting the radiation we should know about. And whenever we like certain people like they have if a certain occasion at home, or if they are planning for anything. So when we receive chemotherapy, that's fine, but when we are getting radiation therapy, what we should know that a radiation therapy should be given in one go. Suppose if I am giving a radiation therapy for 5 weeks, so it will be highly recommended to not take any additional break than already present. Like Saturday, Sunday, I told you, are already usually the radiation is not given. So apart from that, we should not take any additional breaks due to certain if there is some occasion or something. So we should like either plan those things ahead of time, so that the radiation is completed in one go, because even that has relation when it comes to the effect of the cancer treatment. So what it does is, in one go, if cancer treatment is given, the population of cells will be proliferating and it would be suppressed. But suppose if I stop my radiation today and I take a 5 or 6 day gap, so the cancer cell will start proliferating again. So if there is a gap of more than 10 days or 12 days, so I might have to add a correction to it, because in that time there will be many cancer cells proliferating to that level that whatever radiation I have given will not be sufficient enough. So that is what we should know before getting the radiation, is to complete it one go. Definitely we can take like 1 or 2 day breaks if it is necessary, or if certain thing is there that you cannot postpone, but otherwise more than 5 days of break is never like advised. So any questions you wanted to ask?
Amazing. Thank you so much for sharing all of that information. It's definitely helpful for people to recognize any symptoms, any cancer in their bodies, and be prepared for the consequences that will be ahead and the hardships that are there. And even if they're not a cancer patient, the advice that you give to be supportive to their family and friends who are experiencing it themselves, it's been amazing. Dina, anything to add?
Yeah, absolutely agree with Tanvi. It was interesting learning from your professional perspective about how impactful giving support to just giving company to someone who's receiving treatment and undergoing diagnosis is just how significant it is for them, and learning also about the impacts it could have, and things you should expect when you're doing treatment, especially radiation therapy and chemotherapy.
Thank you so much.
Just wanted to say, I love the phrase that you said, that it doesn't impact, you don't diagnose a person but a family. I think that's really powerful, because when we think cancer, we think of an individual, but it completely ripples off into so many other people, whether that be their parents or their siblings or their aunts and uncles, and it has such a big impact. So I want to thank you for that phrase as well.
Yes, like because the family members have to act so strong in front of the patient as well, and they have to, keep building that hope. But because I have seen even in my family, even my relatives have got cancer. So even as an oncologist and as a family member also, so I can understand that perspective, that how you have to stay strong. So your mental health is also important. So it is not just about the patient, but also about the family members.
Thank you. I had one question, and my family actually does come from Delhi. My mom's from there, and my grandmother was diagnosed with cancer, and she lived in Delhi at the time. And I think there was this stigma from her own family in India who were there, as well as medical professionals at the time. How do you think family members should respond to that sort of stigma and fear in ways through conversation, like you were mentioning?
Yes. So this is most important when it especially comes to the developing country, because as I have worked in government hospitals, so I cater to that population, who are not that much literate, and who do not have that much of awareness. So even I have seen stage 4 breast cancer male patient who do not know what is breast cancer, and does it happen even in the males. So I think so first we have to start at the basic level. So what we have is, here we have primary healthcare centers, we have small centers, so we have to start very small. So first of all, I really congratulate you guys what you are doing, because this is how we are going to take it up. So that is, a very major step. What we need is awareness. Just like we did not know about COVID 1 year back, so similarly, the insights about and the awareness about breast cancer, especially the stigma, because even I have seen in my family, like the women of who are of grandmother's age, so they don't talk about, especially when it comes to their breast or to cervix symptoms, like if they are having bleeding, or symptoms if they have any discharge, or any lump in the breast. So these things we have to start at the very basic level. What I tell my patient is, talk to your parents. It's okay if they don't know about, but most of our generation is literate, thankfully. So it is okay for them to not know, but it is not okay for you to not know and not talk to them about this. So talking to your mother or grandmother, when are you having your mammogram, okay, when are you having your pap smear? So these are the basic things we should know. These, because I'm talking about these baseline investigations, because they are cheap, they are accessible to most of the population, and they are highly sensitive. So if the disease in the initial stage, just getting these investigation as an yearly checkup or as a 3 yearly checkup according to the screening guidelines can help us so much. Because it is not like, it is really sad truth, but it is not talked about so much. Like you do not see screening programs going about breast cancer, even if it is the most common cancer. It does not is not in action even in India. So that is the basic. So what we have to do is take the command in our own hands. We have to, like, talk to our mothers, talk to our grandmothers regarding this. Are you having any lump? Teach them. Like, it is okay for them to know. But if I am watching a YouTube video, I am watching an Insta video, so I know how to do a self breast examination. So how difficult it is for me to teach my mother or teach my grandmother? So that starts initially. So what I have done is, now the cancer that would have been detected at the stage 3 or stage 4 would have now been detected, if sadly present, in stage 1. So we are at a win-win situation. So that bridging the gap between the 40s and 50s and in the 20s kids who are there.
Mhm.
So if we know something extra, we don't have to keep it to ourselves, but share the knowledge as much as we can. And I think through your platform, we'll be doing a little effort to towards that direction.
Thank you. Thank you so much. Dina, go ahead with the next question.
Yeah.
All right. So I don't mind. So other than having these conversations and like teaching them, like for instance, like you were saying, teaching them how to examine their own breast to see if they have any lumps and whatnot. Other than conversations, what other activities have you seen that can help cancer patients regain confidence and hope? And
Yeah. Yeah. Okay. So first of all, most of in India, especially, I have seen that not every if you talk about breast cancer, not every breast cancer patient, has transplant surgeries or having breast, augmentation surgeries that replaces the normal breast. Obviously the patient loses a part of her body, and that part that is attached to the feminine side of the patient when it comes to the female breast cancer. So these things should be normalized. So it is okay, we should know about these things. If it comes to the hair wigs, I see so many of patients who do not use hair wigs because they don't know that they are available for them, and it is okay for them to use. So going to the work, continuing the college, having the friends group that sometimes come instead of the family, the friend circle is coming to just cheer them up and normalizing it. Because even if there are like 500 students, not many students would be having, according if we see the population data, so there might be one or 3-4 students, but making it as much as normal, talking about the risk factors, talking about the normal life, talking about the breast cancer survivors. Because I was seeing your videos when someone was suffering from cancer, so they were doing psychology as well, and they were teaching about the cancer, the journey of cancer and how you can your normal life after cancer. So we don't have to be, too much attached to the disease, but to our life and to our routine. So how to normalize with the family members as well as the friend. It is not like that you don't go out with your friend. It is not like that you can't party if you have, So these are the things, like, because even I'll be having a little bit restriction from my side. She is a patient, so I should not bother her. So I'll be keeping her safe according to my perception. But she as a person would be feeling that now nobody invites me to party. Nobody talks to me like they used to before. Even if they talk, so there will be certain gloominess in their tone when they are talking to that person. Chuck that out. Just stay normal. Talk about your life, talk about their dreams. So it is okay. You don't have to, again, that I said, that you don't have to talk about it. Just be your normal self. You don't have to forget that that person already had an existence before cancer. So it is not stopping here. We have to continue, and we have to, be in their journey with them. So I think not every time talking, but being present there. So that is more than enough for them to be, just making their journey simple.
Absolutely. Thank you. That's a really important point, I think. Recognizing that these cancer patients are not just cancer patients. Like, that is just 1% maybe of their identity, if not less. And there's so many other things to them we're talking about. We're almost at the end, but I do have one more question. As you are an oncologist, a medical professional, what sort of advice do you have for students like us who are looking to use medicine as a way to support our cancer community?
Okay, so first of all, this step is very creative, like bringing out the medical professional as well as the cancer survivors together, and the psychologists, because most of us treat only, focus only on the physical manifestations of the cancer and not on the psychological. So I think talking about the psychological aspects of cancer, when it comes to the family, when it comes to the patient as well, and when it comes to the professional life, because no matter how much we say, but it is financially so much draining. Like I've seen in India, people like stopping their treatment in between from the private hospitals because they cannot afford it, and shifting to the government hospital. So these are certain things like financial advisors. So I don't know if how much we can do, but these are the things which I feel that like the help of psychologists, the help of financial advisors, or the help of policy makers. Because if we talk about like US people, like more like 99% of the people do have like life insurances or do have certain policies. But coming from India, I know that is not that common here. So getting treated all by your own money so can be so much draining. So it is draining not even for the patient, but for all the other children. So they are expecting a certain education, a certain lifestyle, but they have to sacrifice everything along the line, down the line, because they have to treat that one person. You don't have to be selfish, but you should know how can you get help. Okay, so because there are, like, I have so many work with so many organizations, there are so many NGOs. So what we have we have Onc Doc karke, we have an organization. So Can Support is an organization which if certain patient cannot afford a certain drug, we take the help of that organization in procuring that particular chemotherapy drug. So I've done like this so many times. So just connecting to two people who can help each other out, I think like will really help the cancer patients.
Amazing. Thank you so much for your time. This has been a really great conversation that we had, and everything that we've learned from you.
Thank you. Thank you so much.
Yeah, so we're going to close off our speaker for now. Thank you to all the audience members that joined us here to listen to Dr. Kavita. We're going to come back at around 3:50 p.m. BST with our next speakers, so stay tuned for that. Thank you to Dr. Kavita, our audience members, and me and Dina will be back soon.
Thank you. Thank you so much.